There's a lot of sick people around right now. Something's going on, whether it's the flu, COVID, or whatever. But you might feel of maybe a vaccine's the course of action for you and your loved ones. Well, we have details on a ton of free vaccination clinics being run by the Toledo-Lucas County Health Department. And Angie Bauman, the Director of Nursing and Clinical Services, is here to talk about that. I saw the list of all the clinics you have, a whole bunch. We'll show them in a minute, but several of them all over this area here. How'd you figure out where the right places are for it?
It's actually a really big accomplishment for our staff. We have a very small nursing and clerical staff, so to pull off this many clinics in this many locations is really a testament to their willingness to be flexible and to want to be out in the community and to be working, because not only are they offering vaccinations at these other locations, but we're still offering vaccinations at the health department.
And we talk, no one likes to wait, so if you can find the right blend of manpower here, there, and everywhere, right, so the lines aren't real bad to get in.
I like to tell people this isn't McDonald's, this is healthcare. So even though a shot seems like it's a really fast thing to get in and out, we still need to verify people's insurance, and we want to make sure that we're doing all the right things. We're providing hand hygiene and answering questions and making sure we're using proper technique. And then of course we're putting that Band-Aid on and sending people on their way.
So, you know, we came out of the pandemic and I was really impressed by the lines at the Lucas County Rec Center and all these different clinics you had around there. It was remarkable, just the whole belt going there, people going in, going out, you go in here, you go in the station to station, and everyone helping. It was quite an achievement.
Yeah. Thankfully, we don't have lines like that right now. Hopefully we don't get to that point again, but it really was quite a time.
Where are we now with flu, COVID? Is COVID still outpacing flu, or has it switched to get things back to normal? I think we're at the point, from what I've been reading, we're kind of learning to live with COVID. We'll never get rid of it totally, but learning to manage it. We have solutions for COVID if you get it, to get milder cases and treat it properly.
Right, and that's why those vaccines are so important, because even if you do get the vaccine, and you may still get sick, but what we're trying to do is protect from that severe disease, hospitalizations, and death. So we really want to just try to keep people in that mild to moderate disease state so that they're not having to go to the hospital for care.
I think we want to care about our kids, and so RSV is a concern for that. Where are we at with treatment for that, and as far as preventing it?
Sure. So that RSV vaccine is actually recommended for people that are 75 or older, or people that are 60 years of age and older and are immune compromised. Then there's that extra set that we want to get vaccinated, and that's pregnant women between 32 and 36 weeks of pregnancy, so that their babies have that protection when they're born. Then there's this other subset of the little ones where they have an immune globulin that's available to them, and that's not exactly a vaccine, but it helps protect from RSV, and that's where that kiddo in the first exposure season to RSV, so babies that were born during RSV season whose moms didn't get vaccinated or are coming up on their first exposure season.
If someone's watching this and you know, been there, done that with the COVID thing, why should they get a COVID shot? Why should they get a flu shot? Because I think, as we found out, it doesn't prevent the two diseases, but it kind of keeps the symptoms down.
Exactly, and we want to make sure, again, that we're protecting against that severe disease, keeping people out of the hospital, keeping people from dying, protecting our loved ones so that they're not going to get sick. In some cases, it will prevent you from getting sick, but you know, we know that those breakthrough cases are going to happen, and that's where we want to just protect from severe disease.
Angie, let's show the graphics now with some of the clinics coming up here. This is just next week alone. Does anyone have to do anything, just show up and walk in, or do you have to make a reservation?
If you have insurance, we need you to bring your photo ID and your insurance card, because although they don't charge for vaccines with insurance, we do still need to, you know, bill that insurance company, but no one will be turned away for their inability to pay for a vaccine. So if someone doesn't have insurance, it's really important to know that the health department is a location that you can come and be vaccinated.
And these are not a real long clinic, 2 hours, hour and a half, 2.5 hours.
Right.
Are you expecting big numbers?
We never know. Some locations we go to and we see just a few people. Other places we go and we see 40 or 50. And you know, anybody that can get vaccinated, that we can help get the vaccine that they're looking for, that's a win for us.
Well, as we get closer to winter, I guess the idea is to just be as prepared as we possibly can.
Yep.
Angie, thanks so much for being here.